Hello, good morning and good afternoon to everyone. I'm Clarisse Msanabaganwa, a medical research analyst at Rwanda Biomedical Center, and today I'm very pleased to speak on behalf of a national research consortium working on leveraging artificial intelligence and data science techniques in harmonizing, accessing and analyzing COVID-19 data in Rwanda, the project known as LAISDAR study. This project is being implemented by different partners led by University of Rwanda and Rwanda Biomedical Center at the implementation side. There are many partners involved in this consortium, mainly University of Ghent, which is supporting on capacity building for AI and other technologies that are being utilized for the project. We do also have Regional Alliance for Sustainable Development, RACID Rwanda, which is supporting on community engagement for the project. We do also have other partners, including Swedish International Development Cooperation Agency and others, among others. This project is funded by International Development Research Center, which is under the Global South for Artificial Intelligence and Data Innovation Program in Canada. And the project goal is actually to leverage international artificial intelligence and data science techniques to create a scalable framework for gathering and analyzing SARS-CoV-2 data with a common data interface for data querying, analyzing, and reporting on top of the hub. What's new on the project? We aim to build a framework for data harmonization to the observational medical outcome partnership for common data model, and also we want to build these analytical tools that may help to predict COVID-19 pandemic evolution and other future epidemics in the country. This project is being implemented in different phases. The first phase, we are trying to compile or to do inventory of all existing data sets on COVID-19 data in Rwanda, from testing, clinic, contact tracing, and genomic surveillance, with the aim to assess quality of data and also to ensure that periodicity and readiness toward the common data model. Phase 2, we are also trying to create the framework for data harmonization to the MOP, common data model, as I said, and this is engaging 15 health facilities which are reporting high number of COVID-19, and we aim to complete this with other isolated data sets. Phase 3, we are trying to also collect new longitudinal and enriched data on COVID-19 from community level using a mobile survey app. The last phase, we are also aiming to build a common data query interface with analytical tools, including OHDSR and other different tools like machine learning, neural networks, for the future use of this platform in the country. We are trying to build a high-level architecture by using this observational medical outcome partnership, common data model formats, and this will be federated data model, and we are actually aiming to create a common interface for accessing and query data. There are 15 health facilities engaged in this, as I mentioned, in phase 2, and the key project modules for longitudinal data, we are trying to collect information at the community on hand hygiene, face mask use frequency, respiratory and flu-like signs and symptoms, and risk situation, social distancing measures, mental health indicators, and COVID-19 testing. The impact of the project, we believe that by establishing this platform, we are going to leverage both traditional mathematical modeling techniques, statistics, and other machine learning methods in the country to predict burden of COVID-19 in the community, but also predict the impact of hospital admission overall infection rate. We also expect the impact on building tools that can be able to predict various public health measures, mainly focusing on pandemic evolution in the community, socioeconomic situation, and mental health status for the population. The progress of the project today, we've been able to launch the project at national level by October 2020. We've been secured approvals from different health research regulatory entities. We build capacities for research team on the concept of AI and also on the concept of use of mobile app and collection of data at community level. We are in the process of completing setup of COVID-19 call center specific for research in the community, and this is hosted at Rwanda Biomedical Center. We've secured data sharing agreements to ensure that the data that are being collected are respecting the data sharing policy for the country. The data collection is going well in the country in all phases, and we aim to collect information at community level from 6,240 participants. We attract collaboration at global level, and we can be reached through the following channels on Twitter, email, Facebook, and YouTube. There's a project promoter, Professor Mark Twagirumukiza, who can be contacted, Charles Ruranga, principal investigator, co-principal investigator, Stefan Jensen, and myself, in case needed. I thank you very much. Have a great day.